the government has also pushed efforts to overhaul the healthcare system in the country. Carla Palmer tells us tonight about the move towards universal health coverage through national health insurance.
Universal health care here in the Bahamas has been an ongoing discussion for decades. Now, the government is hoping to advance the country's position from talk to action. The government has set a target date to achieve universal access to health coverage by January 2016. Health Minister Dr. Perry Gomez is optimistic.
This is the third time we are attempting to do this project. We cannot fail. We must not fail on this occasion. The country expects it, and we must deliver.
The Pan American Health Organization is a strategic partner, and its representative, Dr. Jerry Ackermans, says 4 key pillars are required.
One has to do with financing, to ensure that people do not have to pay out of pocket when they go to a service, that they do not stay away from a health service when they need it because they cannot afford it. The second one has to do with strengthening the health system and the health services. Make sure that services are accessible where people need them, when people need them, and that they have the quality that they need. And that the primary care is an entry point, and primary health care is a ruling that process. And thirdly is about governance. It's that the Ministry of Health will play a role to ensure that all the pieces are in place for a strong health sector, and that it's efficient, that there's not a lot of waste, that it contributes to health. And fourthly, and this is very important, that we look at what we call health in all policies, where governments work together, the different sectors, education, environment, etc., to make sure that where health is created, which is at home, in the schools, in the workplaces, that people live a healthy life.
Deputy Chief Medical Officer at the Ministry of Health, Dr. Delon Brennan, says ideally, the emphasis in achieving universal health care should be on preventative care.
We aren't making sure that prevention is really where our focus is. We aren't getting people the care in their homes. We aren't getting people rehabilitated so that they're back up and functioning, so that they're no longer a dependent on society. What they really are is contributing toward national development and the financing to go along with it.
The symposium ends this Wednesday. Carla Palmer, ZNS Network News.